Hey everyone, this is Quinn Pettifer with the Gazette, and you are watching Get to Know Gives Back. This is a program that is supported by our program, The Gazette Gives Back, which is an annual program that provides over $500,000 in free advertising to 40 nonprofits that exist throughout Eastern Iowa, serving thousands of people literally every day. We are really excited to have our presenting sponsor, Collins Community Credit Union. They are supporting us throughout the entire year, and for this series, Get to Know Gives Back, which gives us an opportunity to talk to our nonprofits a little more in depth, learn a little bit more about their mission, the resources that they provide, and of course, anybody that is interested in volunteering or getting to know more about their services or support, we always end with that note. And today I'm really excited to have Erin Langdon here with me with the Eastern Iowa Health Center. Erin, so one of my questions on the list that I sent you, I had to stop myself and I'm like, really, am I going to ask that? Have you had to pivot much since 2020 and into 2021? I'm going to guess, yes, for you guys. I'm like, this seems like a very silly question, considering all you do, but just in case, one, welcome. Thanks for taking some time to join me. I know you and the team are just going nonstop. So thank you for being with me today.
Well, I want to say thank you for having me, Quinn, and thank you to the Gazette Gives Back and Collins Community Credit Union. We are very grateful to be a participant of this program and be able to use the advertising through the program to continue to share our mission and work. So we are Eastern Iowa Health Center. Our mission is to provide exceptional and accessible patient-centered healthcare for all. So in 2020, as a healthcare organization, we definitely had to pivot our services that we provide to Eastern Iowans, and that's all Eastern Iowans. So no matter your insurance status or your income level or your housing status, you can get great, excellent care at EIHC. Our main service lines include family medicine. So just when you or I need to go to the doctor for an annual physical or a sick visit, acute need. We also have a pediatrics service line where we serve kids newborn up to age 18. We do behavioral health services in 2 of our locations. So therapy and coping skills with our therapists, our licensed social workers. We also have a full women's health clinic. So they do anything, including labor and delivery. In any given year, we deliver between 600 and 800 babies in the corridor. And we have 5 OBGYNs that do that at both hospitals here in Cedar Rapids. And then we also have a full dental practice, and that is very busy. And so they have had to, well, everyone's had to pivot, but they, especially dental practice with the PPE requirements and just the nature of that work, have had to shift how they do their work. So yes, there's been lots of changes. One of the big changes that we have done early on, so I would say in March and April of 2020, was we started telehealth. We had talked about it, and we're trying to figure out, especially for our patients, the majority of our patients do live in poverty, so 200% or below the federal poverty line. So knowing that there's not always a stable internet connection or cell phone with data, we hadn't quite gotten there before the pandemic, but just with everything, we knew we needed to provide multiple ways to access our services for patients. So in a pretty quick time frame, I would say about a month, we started telehealth services. So now our providers are able to touch base with our patients on the telephone if that is the best way to get them in that moment via telehealth. So that would be with the video component. And we've been able to start small with Zoom like we're on right now, which thankfully is a HIPAA compliant platform, but we've transitioned to a platform that now works with our electronic health records to make things a little more seamless, both for the patient and the provider. So we do a lot of our therapy visits are now via telehealth, just to make sure that our patients get that social distance, but that they're still able to access care. And then there are other services for more preventive well child, chronic illness management if someone's stable, that we can do via telehealth. And that helps keep that access for all of our patients, because one, that enables our clinics to be more socially distanced if we don't have quite as many patients coming in the buildings. And then it gives our providers that flexibility to meet the patient where they are. So we're pretty sure telehealth is here to stay. We're still ironing out kind of what appointments are appropriate for telehealth and what might not be, and those processes. But that was one of our biggest changes. And then we also have had patients and employees who have needed COVID testing. So for a long time, we had a tent in the parking lot. That was the best way to keep people safe until the derecho blew it down. And thankfully, we've gotten some assistance. So we were able to purchase the old His Hands Free Clinic across the street. So that now serves as our respiratory clinic. So any patient was sick or needing a COVID test will go there. And I'm going to try to stop talking, but the last thing that we've started doing is vaccinations. So we are a COVID vaccine provider. We vaccinated our Tier 1A employees. So obviously we have healthcare providers who have that direct exposure to patients. And then we also served as the vaccine site for some of the independent healthcare and other providers, dentists, eye providers in the county. So they came to us to get their vaccines. We're currently trying to get through the second doses. And we also have a very small allotment for our 65 plus patients. So we will continue to work with Linn County Public Health. It's been quite the team effort here in the county, and we are going to try to get our patients vaccinated with all the guidance from CDC and Iowa Department of Public Health just as quickly as we can get the doses. So
that's it's hard to even know how to respond to all of the different pieces. And I know, Erin, we the Gazette have had a lot of really great conversations with the center specifically about telehealth and just how that quick pivot, that quick need to respond has been, like you said, a silver lining in terms of telehealth is probably here to stay. But the impact of all of these pieces to you and the team, and of course your clients, how do you even start to map out 2021? I mean, I part of me is like, I guess like the mentality of like, if you can survive 2020, moving
right.
forward is going to be just, walk in the park. But are there things that you are adapting or adopting for the long term, or are you still kind of in that, like, we're kind of moving pieces as we go? How does 2021 look for you guys?
So our leadership team, our frontline staff, everyone has been so adaptable and flexible this past, I guess it's almost a year now that we're in February, and that's been really great. We really do want to try to get back to a strategic focus, and we understand that it might not be at the forefront every minute of every day. We're going to continue to need to be reactionary with vaccine rollout and continued testing and messaging around the pandemic, because that is obviously at the forefront. We want to do our best to help get that under control and in the rearview mirror as soon as possible. But we actually went through a process right before the pandemic to kind of redefine some of our values and our vision. And we really do want to be that trusted healthcare partner in the community with all of our partners, whether that be other healthcare providers, whether that be our nonprofit referral partner agencies like HACAP and Willis Stady for housing assistance. I mean, we work with a number of agencies. So as we continue to respond to the day-to-day and acute needs, we also are going to look at how EIHC can continue to serve more patients and provide them with the services in a manner that they need. We really pride ourselves on a team-based approach and being a patient-centered medical home. So I might need a different approach to healthcare than a patient who is struggling with chronic homelessness. So whether that be that we continue to focus on care management for our patients that might need that extra assistance from a nurse, whether we look at expansion of dental, because we know anecdotally that our dental clinic is bursting at the seams. We have 8 exam rooms and 3 dentists, 3 hygienists, and they unfortunately can't take all the patients that need the care. So as a team, we're going to really dig into that, start to do the needs assessment, see what the community needs. And we also serve 5 counties. So the majority of our patients live in Lynn County, but we also serve patients from Johnson County, Benton County, Jones County, and Iowa counties. So maybe looking to see if there are more outreach type education events or transportation assistance. So we'll keep moving forward and really just trying to make sure that our services are available to anyone who needs them. But I will say that I would imagine 2021 will still be a little bit reactionary as well.
Yes. Well, you guys are doing a fantastic job, and I know your partnerships and just every way that you have had a chance to build on what you do so well, and also just adhere to the needs of the client, take down any barriers that are going to prevent your clients from coming to you for services. That just continues to be something that you lead in doing. So thank you for that. And thank the team for, on behalf of all of us, for all you're doing. If there are people that would like to support or volunteer, or just lend a hand in some way for EIHC, what's the best way to contact you?
So if you're interested in volunteering, I am going to put it out there right now. In this environment, we don't have the most volunteer opportunities, but we do have some kind of like one-time bigger projects when the clinic might be closed and we could use some able-bodied people. I also am going to say that we are one of the partners of Eastern Iowa Diaper Bank, and there are more opportunities there. So anyone can reach me at the clinic. You can call 319-730-7300 and ask for Erin Langdon, or you can also find me on our website and email me that way.
Excellent. Well, thank you, Erin. And of course, anybody that needs services, of course, same kind of contact information, phone number, website, all of the ways that you are providing those services are listed by phone or online. And thank you so much for joining me today. I know it's hard to even get 5 minutes away to have this conversation. Your team is working nonstop, and so are you. So thank you for that. And we are very grateful for all you're providing Eastern Iowa. And we're very proud that you're part of Gazette Gives Back 2021. So thank you.
I just want to say thank you again. We're so thankful for the program and we appreciate the time.
Excellent. Keep going. And thank you to our viewers for checking out another edition of Get to Know Gives Back. This is part of the Gazette Gives Back program, which is sponsored by Collins Community Credit Union. If you want to learn more about EIHC, Erin and her team and the great work that they're doing, as well as all of our nonprofits that are participants for 2021, you can go to thegazette.com/givesback. We've got all sorts of information on there. And I am Quinn Pettifer with the Gazette, and we'll see you next time.